All right, so this is where we talk about what to do, and you may be asking me as we go through this, is this really going to help? And I'll tell you yes. If you've already gone through the other things, like I mentioned, the very mechanical things like, high arch, low arch, and what to do about it with shoes and, heel stuff and the tape job and all that other stuff. If you've done that for a couple of weeks and it's not continuing to get better and better and better, then you need to consider what I'm talking about here, okay? This is stuff that people generally don't get an earful of. I'm going to give you an earful of it because it's something that needs to be talked about more often. So we'll talk about the sitting position first and why it matters, okay? So whenever we're sitting down, unless we're 6'6", not the majority of us, the front edge of the chair is driving into the back of the thigh, okay? And so what's right there is your sciatic nerve as it splits off into the tibial nerve and common peroneal nerve. You don't need to know all that. Just know that that's where the nervous system is. It's getting pressure on the back of your thigh, okay? And whenever you sit down, you're also putting pressure on your sciatic nerve. Why a lot of people that do sit-down jobs get sciatica. But particularly important is the pressure that builds on the front edge of a chair that drives in the back of the thigh. And what that ends up doing is if you've had Achilles tendinitis in the past or you've had an irritability in that area, well, it's just an additional effect of if the sciatic nerve's not feeling happy and maybe you did something to make this area not feel all that great, well then the nervous system starts to pop off. You already gave it a signal to give you some pain, and so now that area starts to become more upregulated and giving you sensations that aren't normal like the other side, okay? So sitting position, really important. And on top of that, if you're sitting down and you use an ottoman, you just kind of lift your leg up and that's kind of the position you're in. Just know that when your leg is straight, you're putting tension on the entire nervous system as it goes down around your low back, your hip, back of your thigh, back of your knee, and around your Achilles tendon. It just it puts the area, that structure, think of it as one massive long tendon from your low back all the way down to your foot. You're putting it on stretch, even though it may not feel all that bad sometimes while you're sitting down or while you got your leg out in front of you, you don't feel it. You're setting up the environment to be less normal when you ask it to actually do something, okay? You're giving it maybe a little bit of input to say, well, you know what? I'm going to let them know that didn't feel all that great to begin with. Let them know that I wasn't feeling all that fantastic to begin with. And I'm going to let you know when you actually try to do something. All of a sudden, it's like, what did I do? It hurts again. Sometimes this is the thing that sets it off and gives it an opportunity to be not very successful with movement when it's under stretch for a prolonged period of time, whether you're just kind of minding your own business and you got your foot up on the ottoman. So what do you do about both of these? Well, you end up kind of slumping a little bit, getting yourself a little bit more on your tailbone, a little bit more. I know this is slumping and everyone talks about you're not supposed to slump. Well, for this, I'm going to give you the green light to slump a little bit. Maybe not from the top down, but from the bottom up, and just kind of be on your tailbone a little bit more, okay? So you're, instead of on your hips on the outside, you're a little bit more on your tailbone. That's helpful, okay? Number one. Number two, your knee ought to be just slightly higher than your hip, so put something underneath your foot, not underneath your thigh to lift it, because the idea is to get pressure off of the back of the thigh. Put something underneath your foot, okay? So that you don't have hardly any pressure on the back of your hip, back of your thigh, anywhere down the road, and it's not straight and getting stretched out, okay? That's important. So that's, you just consider any kind of sitting position, any seat you're sitting in, and that's really what the position you ought to be doing. And do I mean, whenever you sit down? Yes, I do. Whenever you sit down. Okay. If you want to do it, if you want to sit down a little bit more normal, a couple minutes or so, okay, fine. But you need to back off and consider what I'm telling you. And you need to invest a lot of time on the front end of making this whole system feel better on the front end, so that it starts to feel like it can do what it needs to do and not give you a pain signal. Okay, so that's the sitting position. And in your car, what I would tell my clients, recline your seat 1 or 2 clicks, bring it forward 1 or 2 clicks, as long as you're not feeling like your knees are in the dashboard, just comfortably away from the steering wheel still, but 1 or 2 clicks reclined, and 1 or 2 clicks forward, so that you create this a little bit more. And if you can, the seat that you're sitting on in your car, the driver's seat, angle it down towards the pedals and max that out. So what that does is it makes it so that when you're like this, same kind of thing, the front edge of the chair that you're sitting on isn't driving into the back of the thigh. Same kind of thing, okay? So if you're in the recliner, go ahead and recline, that's great. But that platform that swings up for your legs, go ahead and bend your knee and firmly plant your foot on that platform that swings up for your legs, okay? So that is the sitting position, okay? And that's just really valuable to talk about, really super valuable information, and you're gonna need to know that. I'll get into a little bit more about lying down and why that can be valuable as well. And we'll get this thing taken care of.